Knock, knock, knock. May I come in?
Yes.
I'm gonna wash my hands. How are you doing this evening?
Pretty good. How are you?
I'm good, thank you. I'm Lily. I'm gonna be your student nurse today. I'm gonna be performing a general head-to-toe assessment.
Okay.
Before we get started, can I ask you a few questions?
Excuse me, if you can.
Can you please state your name and your date of birth, please?
Haley Humphrey, 3/29/2000.
And do you know where you are this evening?
I am in Gainesville, Florida, in my house.
And do you know approximately what time it is?
It's almost midnight.
Okay. And what is your reason for seeking care today?
General checkup.
Okay. So now I'm going to verbalize the general survey.
Okay.
Patient is alert and oriented. Patient skin is consistent with genetic background. Speech is clear and understandable. Patient hearing is consistent with the sound, and facial expressions is also consistent. Body fat is evenly distributed within healthy ranges and is well hydrated. Patient is well groomed and is wearing clothes consistent with weather. So now I'm going to move on to vital signs. From a scale of 0 to 10, 0 being that you have no pain and 10 being that you have the most pain. Can you please rate your pain?
0.
So you have no pain.
No pain.
Okay, vital signs and assessment are within expected ranges. So now I'm going to move on to neurologic. So eyes spontaneously open with no presence of proptosis or facial drooping. I am now going to check for your capillary reflex, or not capillary, pupil reflex. Okay. Perfect. And can I ask you to drink some water?
Of course.
Patient can swallow. I am now going to check your strengths. So
Okay.
if you could grab onto my hands and squeeze really tight. Perfect. And if you mind laying back for me. Okay, I'm going to put my palms on your feet, and can you push for me? Perfect. Okay, do you mind laying this way for me? Okay, so I'm going to have you close your eyes, and if you feel anything, please let me know where you feel it.
Left arm.
Mm-hmm.
Right arm.
Mm-hmm.
Left leg.
Yep.
Right leg.
Perfect. Okay, you can sit up if you'd like. I'm now going to do your respirations. So I'm going to listen to or palpate your radial pulse. In this part, I'm actually going to be watching her respirations for 1 minute. Okay, a minute has passed. Can I have you breathe in deeply for me? And exhale. Perfect. And can you cough for me? Perfect. I am now going to listen to your lungs on the front. And I'm going to be listening to it in the back. Now I am going to move on to the cardiovascular section. I am going to listen to the apex of your heart. Okay, now I will listen to the apical pulse and your radial pulse. Use this hand. Thank you. I'm palpating the radial pulse and listening to the apical for 1 minute. Okay, now I'm going to listen to your heart. Okay. Now I'm going to check for your capillary refill. Okay, and I'm going to do feet too. Perfect. Okay, now I'm going to check for peritibial edema. So if you don't mind, could you sit sideways for me? Thank you. I'm going to look at it bilaterally. Okay, now I'm going to look at your posterior tibial and your dorsalis pedis pulses bilaterally. Okay. Okay. So now I'm going to move on to the skin assessment. So I'm going to inspect your skin and also palpate it. Thank you. Thank you. And can I see this leg too? Thank you. And I'm just going to check for your turgor, please. Perfect. So skin is smooth, intact, warm, and dry. I'm now going to move on to your abdominal assessment. So if you could lay down for me. I will first inspect the abdomen. Okay. Now I am going to listen to your abdomen in all 4 quadrants. Okay. I am now going to palpate your abdomen. If at any point you feel any discomfort or pain, please let me know. Okay. Okay. And that is the end of our general